Once again, it's time to sign up for Medicare and to explore new options in coverage. To bring us up to date on what's being offered and how to get some guidance is the health insurance specialist from the Boston Regional Office of the Centers for Medicare and Medicaid Services, Jennifer Syria. Thank you very much for being with us, Jennifer.
Thank you for having me.
Jennifer, there are some people who might think they can just do this on automatic pilot because they're already covered, but why should they be out there shopping?
Every plan changes every year, and more importantly, your needs might have changed since the previous year. So it's important to keep all of those factors in mind as you head into the new open enrollment period. Overall, individuals, their needs change so dramatically from year to year that perhaps that low-costing plan that they purchased this year with some high out-of-pocket costs worked for them well for this year, but next year, if they have a surgery plan, for example, this is a good opportunity for them to take a look at their plan and see if there's an option out there that might cover them a little better.
Well, one thing that makes it a little tricky, for me at least, is if I'm shopping and I see I can get drug coverage a la carte, I can also get drug coverage from a Medicare B plan. So, I mean, how do you help people sort that out?
Well, you ask them what are their most important needs. So, for example, if there's a physician that they really want to continue seeing, or if there's a hospital they want to make sure they have access to, or an important medication that they have, we want to make sure that the plan that they are selecting from works for them, for those needs. So a plan that works with their physician, for example. Another factor that comes up a lot is whether or not they might be traveling throughout the country. We have a lot of snowbirds in this neck of the woods. So if they're going to be down in Florida for a couple of months, then we want to make sure that there's a plan available to them that will cover them while they're traveling as well. And so we've created tools on Medicare.gov to help with that process.
Well, I think another thing that people have to think about is whether you go with a Medicare B plan and how you make that work with a sort of a local private provider or something like that. I mean, how do people figure that out?
So we have some great tools on Medicare.gov that can walk somebody through that process by asking some important questions, such as their physicians, what are their prescription medications, and that will help weed out all the options that might be available. More importantly, though, we have local community sources to get that information. So we have a wonderful program here in Massachusetts called the SHINE program, which allows an individual to meet with a SHINE counselor one-on-one. So SHINE counselors are located at your local community centers, your senior centers, and you can make an appointment for some help.
I don't want you to have to dive into a laundry list here, but I imagine some of these have people who can speak other languages besides English too?
Oh yes, especially in those communities that need that extra support. So throughout the state we have individuals who can speak a number of different languages, or at the very least can partner with somebody who can speak a language and use an interpreter service if necessary.
You're also getting some help this week from Ethos, which is a senior agency in Boston, and there's an event coming up, so they're going to help people figure out some of the enrollment questions too? Yeah,
we have a great enrollment event happening on Wednesday from 11 to 1 o'clock at the Veronica Smith Senior Center, yes. So not only will we have SHINE counselors on staff that can help somebody understand their options 101, but we'll also have some students from Northeastern that can look at their prescription medications, for example, and help explain some of those medications to them, as well as review some additional details about their health.
Now there are some people who say, I think I can figure this out myself. I can go online. I mean, how easy is that these days?
I mean, I've been doing it for years and it seems very easy. It's a matter of just entering your information and kind of comparing those options. So for the savvy individuals, we've actually made a more robust website for this year. We've added some great tools that help compare options a little bit better, run through some of those important questions such as, is your physician going to be part of this plan, or do you need more flexibility? But in addition to that, even those individuals who are savvy, they're still going to have questions. Our customer service number for 1-800-MEDICARE runs 24 hours a day. So if they're halfway through that process, they feel that they're comfortable but have a secondary question, they can give it a call. Or we also have a web chat feature available this year for open enrollment.
By the way, does that happen very often, that people have to maybe give up a physician that they've come to know very well because of what's restricted in the options?
What's important to know is it can happen. So every year, these individual insurance companies have contracts with each hospital, with each doctor, and so sometimes those contracts need to change. And so it's important for everybody to take a look at their plan and what it will look like for next year. Even if they were very happy with their plan this year, next year it's a new plan, it's a new contract year, and it's important for them to review their options again.
Well, we should mention if people cannot make the event in Brighton, there's a number they can call, maybe 2 numbers to get some more help?
Yes, I have a couple of numbers. The first number I want to provide is for those that are Boston area residents who want to schedule a visit with their local Shine counselor. They can call 617-477-6676. If you have a family member that's outside the Boston area that wants to make an appointment, they can call our statewide number for the Shine program, which is 1-800-AGE-INFO or 1-800-243-4636. And of course, Medicare is also available, so 1-800-MEDICARE or 1-800-633-4227.
Thank you very much for being with us.
Thank you so much for having me again.
Jennifer Syria from Centers for Medicare and Medicaid Services.